Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, welcome. We're back once again talking about our Gold Neonatal Conference coming up right around the corner here. And I can't wait to see so many of you online. I know so many of you have registered already, which is so exciting. And many of you, of course, are coming in your groups this year, which is fabulous. Oh, it's just great when you have a team of folks learning together online, particularly, and you can share in all the wealth of the knowledge and do some debriefing as well. So here we have Dr. Patty Scott is with us here today, or officially Patricia Scott. So welcome, Patty. It's great to have you here. Patty, you're going to be sharing about the many uses of telemedicine in neonatal care, which we'll talk about in just a minute. But of course, I want you to introduce yourself and tell us a little bit about your life, where you are in the world, and what you do.
Okay, I'd be glad to. Thank you. So my name is Patty Scott. I live in the United States in Tennessee. Yes, I'm in the South. And I live right outside Music City, Nashville. Probably many of you have heard of it. I live right outside. I've lived here most of my life. And I'm married. I have 2 grown daughters. And I have 3 fur daughters. Doggies, for those of you that don't know what I mean by fur daughters. But I have 3 dogs. I've worked here in Nashville as a neonatal nurse and then a neonatal nurse practitioner since 1986. So I've been doing it quite a while. And I'm also an assistant professor of nursing at Vanderbilt, and I teach in the neonatal nurse practitioner program. So I'm very excited to be part of the conference this year. I'm very excited about our topic. It's been very interesting to not only use telemedicine, but to learn more about it.
Yeah, absolutely. Well, thank you so much. We can definitely hear that nice Southern accent there from you, Patty. But it's absolutely wonderful to have you here. Your wealth of knowledge, your experience, you've been doing this for a while. You've been doing this for a while. So lots of gratitude to you. I know that you have mentored many folks already, but I really wanted to go back a little bit in time with you just for a little bit of fun to find out, what your motivators were, because you have been doing this for a while. What got you into nursing, and was this your first stop? Was neonatal the place you thought you were going to land?
I'm not really sure what drew me to nursing. I always wanted to be a nurse. I just always wanted to be a nurse.
Mm-hmm.
I don't think I always knew I wanted to do neonatal. When I went to school, I did a 2-year program. Then I went to work at Vanderbilt and took advantage of their nursing scholarship and went back for my bachelor's. Because I was already a practicing nurse, I got the opportunity to go in some different clinical areas. And so I went to the NICU there at Vanderbilt. And I fell in love, just fell in love. And I had to wait out my time because at that time it was hard to get into the NICU as a new graduate.
Right.
So finally in 1988, I was able to wiggle myself into a position in the NI. And who could ever leave? Once you're there, who could ever leave? I can't even imagine taking care of a patient that weighs more than 10 pounds.
They're too big then. Yeah.
Yeah. I love the babies, and I love their moms, and I love their dads.
Oh, so that's wonderful. That's wonderful. Well, your story, rings true of so many folks that I have spoken to over this past couple of weeks who are also presenters like you coming up at the conference. Sometimes they wonder why they got into nursing, how they got into nursing. But for sure, once they land in the neonatal unit, they found their footing, they found their placement in life. And so there's a stronghold, I think, that happens, in the neonatal units. And I would say that from an outsider looking in, I've had limited experience in the neonatal units, but what I've seen over the years is that, there has been limited resources and little light sort of shed on, neonatal units as a whole. But today I feel like there has been a big shift. There seems like there's a lot of collaborative work, a lot of research happening around the world. Is that a similar perspective from the inside, Patty? Can you tell me?
I agree with you 100%, Fiona. And I would add to that quality improvement. There's also a lot of quality improvement going on within newborn intensive care units. I'm not sure if you've heard of Vermont Oxford Network, VAUGN, which is a big perinatal collaborative here in the United States. Actually, I think it's a national organization.
Wow.
So they have a lot of initiatives to try to improve care in the newborn intensive care unit. And then a lot of states in the United States have got
Hmm.
state collaboratives. Tennessee has one. It's called
Hmm.
Tennessee Initiative for Quality for Perinatal Quality Care, TIP
Right.
QC.
Yeah.
And we do all kinds of great projects here in
Mm.
Tennessee. So I really like the quality improvement aspect of it.
Absolutely, absolutely. And so it sounds like there's even in a national level that you've really needed this collaborative type of care, working together, finding out what each, group is doing, neonatal unit is able to achieve, because that improves overall well-being then locally, nationally, internationally, right? That's what's happening,
Certainly.
which is
Yeah.
wonderful.
It's wonderful because you can share best practices. You can share
Hmm.
in your unit. It may not work in another unit, but it may work in a unit. So that sharing really helps all of us improve the care we're giving.
Yeah. Okay. So let's take it to the international level. How have you seen, or what have you seen, when a country like, perhaps the United States, which is where you're located, starts to collaborate and work internationally? What have you seen? If you had contact, I mean, you've probably seen some things on the internet, I'm sure, but it seems, again, looking from the outside in, I see a lot of research being shared on a regular basis. What has been your
Mhm.
experience, Patty?
I would agree with that. I would agree with that. One of the physicians that I work with here in Nashville does a lot of work in the Middle East, where some
Ah,
of the resources are not as plentiful as we have in
right.
the United States. So he has been a diligent provider of supplies and equipment to the Middle East to try to
Amazing.
improve neonatal care there. I have another colleague that is very involved in care in Japan, and
Oh,
she has
yes.
done some wonderful things with nursing education, not just advanced practice nursing, but also basic, entry level nursing education. So she's done a lot with that, and it's really gratifying to see what people can do in some of those countries, the sharing that goes on.
Yeah, absolutely. It is, and it is wonderful. So overall, I mean, we're so fortunate that there has been this huge shift and improvement, a sharing of information, resources, a sharing of resources. I mean, why not,
Mhm.
right? I mean, it's
Right.
important that we do our absolute best. And I think that, I know on neonatal units, you look at each other as a family, and that, it's a small village that you have, but yet that village can, be powerful in other parts of the world, which is amazing. That's wonderful. Well, that brings me to our conference. I mean, listen, I'm going to brag a little bit right now, Patty. I'm going to tell you that we love our conference here at Gold Neonatal. We're into our 6th year, and that just tells us that there's people that want and need this education and come back year after year. And we do have an amazing international audience here that we're so blessed to have. So I know that they're going to share and love what you're going to be sharing as well. So we do a lot of collaborative work here, and we really love it when, of course, our participants are engaged in the topic. So you're
Sure.
going to be sharing a little bit about the many uses of telemedicine in neonatal care. Now, tell me, don't tell me too much about the presentation, but we'll get to that in a minute. I want to know kind of, again, your experience of getting into this, or, if you had any reservations, or how did it all come about? So let me just hear a little bit from your side.
So my experience with telemedicine has been to provide care mainly in level 2 nurseries, level
Mhm.
2 NICUs in rural areas,
Ah,
and that
yes.
we don't have the subspecialty of neonatologists in those areas like the areas would like to have. So
Sure.
telemedicine has brought the specialist to the rural hospital,
Mm,
maintaining those families, to keeping those babies in hospitals where good care can be delivered and the mom and dad are just right down the road.
mm,
Keeps the baby in their community. Doesn't work for every baby. Some babies will still need to be transferred out because they need a higher level of care, but a
sure.
lot of babies can be maintained in their community. And using telemedicine to bring the neonatologist to that bedside has been amazing.
Oh, that just gave me goosebumps all over because one of the things that I love so much about my practice is keeping families together, keeping,
Mhm.
parents together, mums and babies together. Because the literature does read that if they stay together, they actually heal better and get discharged sooner. Is that right, Patty?
That's right. And it's also great for breastfeeding. And we're always advocates for breastfeeding.
Wonderful. That's wonderful. Okay, so let's get into the topic just a little bit more, because I know I want you to set up our students, all of our participants, really well for this topic. What can they anticipate when they come in to your lecture at the Gold Neonatal Conference this year?
I think they will be surprised at the many uses of telemedicine.
Mm,
And some of this did not start because of the pandemic. Now,
right.
some of it
Yeah.
did, but a lot of it didn't. I think they will be
Hmm.
surprised to see how people are using telemedicine and also some of the work that's been done to compare telemedicine to traditional
Mm,
medicine. Are the parents as satisfied? Are the bedside staff, are they as satisfied with
sure.
telemedicine care? So I think they'll be surprised. I think they'll be
Okay.
surprised with those results. And I think they'll also be surprised at some of the way out of the box ways it's being used.
Oh, fun. I mean, what better what better way to set folks up? You've got to come now to the live presentation. But truly sharing of information is what we're about here. And I know that's why we invited you to speak on this topic. We want everyone to have the opportunity to learn some of Patty's experiences, her team, and what has transpired so that you can take it into your networks, into your neonatal units and put it into practice there. So stay tuned. This is going to be a really great topic, the many uses of telemedicine in neonatal care. Thank you so much, Patty. It's been fun having you here today.
Thank you. I look forward to it.
Absolutely. And we'll look forward to having you back. You'll be live at our presentations at our neonatal conference, which is exciting for many of you, I know, because you'll be able to come in on the day and ask questions. We'll have a live Q&A with Patty, and I can't wait to host that as well. Now, for some of you, I know you will be disappointed. You might not be able to make it that day, but don't forget you'll be able to register and watch all the recordings. And we do have the dedicated forums, of course, for all of our speakers. But go online right now at goldneonatal.com where you can register for this event. You can check out all your local time zones in order to come to the sessions live. Thank you again to Dr. Patty Scott for being with us here today. And of course, to all of you, our viewers. Bye-bye for now, everyone.
Thank you.